Welcome to Clara Compliance Chronicles.
Ever try keeping track of something super important? Like if you lose it, even for a second, things get really stressful, right? Now imagine that, but instead of your keys, it's medication. And the stakes, way higher. That's what hospitals deal with every single day with controlled drugs. It's a whole world of tight regulations and being constantly on guard. So today we're diving into this really interesting article from the Pharmaceutical Journal. It's a big deal for pharmacists. And it's going to be our guide as we break down how hospitals are using technology to make this whole system managing these controlled drugs safer and, dare I say, maybe even efficient. One of the things that really struck me reading this was just how many rules and regulations there are around controlled drugs in a hospital. It's not just one law, it's like layers on layers on layers, starting with like the Misuse of Drugs Act from 1971. And it just gets more intense from there.
It really highlights that balancing act.
Yeah.
Hospitals have to prevent any chance of misuse or even criminal activity, obviously. But then on the flip side, you have to make absolutely sure that the patients who need these medications get them quickly and safely. So, yeah, high stakes all around.
And that's where the Controlled Drug Accountable Officer comes in, right?
Yeah.
The CDAO.
Exactly. Every single hospital has one. They're the point person for making sure the hospital follows all those regulations. And we're talking like regulations from the home office setting drug policy, the Care Quality Commission, the CQC, making sure standards are met, and then the General Pharmaceutical Council, or GPHC, specifically for pharmacists. It's a lot.
Wow. It's kind of mind-blowing when you put it all together like that. And this article goes even deeper. They outline every single step for actually handling these medications, ordering them, specialized record keeping, stock checks all the time, making sure they're moved between departments safely. And that's before we even get to disposal. Every step documented. Can you imagine the paperwork? Honestly, reading all this, I have so much more appreciation for the pharmacists and nurses who deal with this every day. The article even mentioned some pain points, like just trying to track down the right person to sign something on a busy ward, the time that takes away from patients.
And that's where the consequences of this whole complex system, they become really clear. Because even a small error, it can have big consequences. Not to mention the delays in getting medication to someone who needs it, like right now. And of course, the potential for medication being misused, that's a risk hospitals can't take. But on top of all of that, the workload for the staff is just enormous. You got to wonder how much more time they could spend with patients if things were, a bit less complicated.
It's a lot. And the article mentioned the statistic from a CQC report that really got to me. On average, 8 unaccounted for controlled drug losses are reported every single day. In England alone. That just shows how much we need a better system, don't you think?
Oh, absolutely. That number's pretty alarming. But it's interesting. Technology might actually be the answer here. And that's what this article explores, this idea of using automated dispensing systems, and digital record keeping to make this whole thing run smoother.
So we're talking about, like, instead of those old cupboards with a million keys and tons of paperwork, it's medications stored securely and tracked, like, in real time. Only accessible by the right people, maybe even using, like, fingerprints or something. Sounds futuristic.
It does, doesn't it? But it's already happening in some hospitals. Imagine, you've got secure storage, and to get in, you use biometrics, like a fingerprint scan.
Yeah.
So much safer than keys, right? And no way someone can just, grab something they shouldn't.
And if we're ditching all that paper, does that mean we can track these medications in real time? Like, actually know where each dose is?
That's exactly it. Real-time tracking is huge for controlled drugs. Instantly check the location, the status, everything. And because it's all automated, digital, you've got this perfect audit trail. No more trying to read someone's messy handwriting, This system tells you exactly who accessed what and when. So if there's an error, you can catch it way quicker.
Okay, this is straight out of a spy movie. The article mentioned using fingerprints for, like, delivery notes. That caught my attention.
Right. It's such a smart solution.
Right.
Think about it. Instead of a paper trail that can go missing, when a controlled drug has to move, say, from the pharmacy to a ward, the delivery note is signed electronically with a fingerprint. Way more secure. No question who handled what.
Wow. That level of, like, accountability is incredible. And it sounds like these automated systems, it's not just about, like, reducing risks, right? It's actually making the whole work environment better.
For sure. One of the biggest wins is efficiency. Nurses, pharmacists, they're not wasting time on paperwork or hunting down keys. That means more time for patients.
Makes sense. Especially with how much they have to deal with already. So we're talking fewer errors, better compliance with all those crazy regulations, maybe even saving money in the long run.
You got it. Automation takes out a lot of the chances for human error. And yeah, a lot of experts believe these systems will save hospitals money over time. Less waste, everything streamlined.
It's amazing to think about how different things could be, but are there hospitals actually doing this? Where is it working?
Oh yeah, the article mentions a few. Leeds teaching hospitals, for one. They implemented an automated system, and the time it takes to dispense controlled drugs cut way down.
So more time with patients. Are other places seeing that?
Definitely. Belfast Health and Social Care Trust. Big decrease in errors, which is all about patient safety. And University Hospital Coventry in Warwickshire, their pharmacy technicians are saving tons of time, all because of electronic record keeping.
It's incredible to see it actually working, Feels like a real turning point. But the article also said this hasn't exactly become the norm everywhere yet. What's the holdup?
Yeah, good point. The article talked about a few hurdles. One of the big ones is, well, the rules themselves need updating. A lot of the current legislation, the guidance around controlled drugs, it's all designed for that old way of doing things. Paper, manual, all that.
So even though the technology's there, the rules haven't caught up.
Exactly. And the authors are really pushing for a reevaluation of those standards. We need new guidance that makes sense for these automated systems,
Like trying to use an app that hasn't been updated in 5 years makes it hard to do anything. What kind of problems does this disconnect cause?
Well, for one, there's still a lot of debate about how to apply some laws, like electronic prescriptions for controlled drugs, but within these new systems. It's a bit of a gray area.
Innovation versus bureaucracy, the classic struggle.
Right. And then we need a more unified approach nationwide. Right now, every hospital is kind of doing their own thing, which creates inconsistencies, standardized policies, clear procedures, even the training. That would make a big difference in getting everyone on board.
So, streamline and unify, that's the key. Looking ahead, though, if these systems did become the standard, what could that mean for patients and for the people working in hospitals every day?
Honestly, I think the potential is huge. For patients, it's that extra layer of safety. Less chance of errors means they're getting the right medication the right way when they need it. And with these kinds of drugs, that's crucial.
It's reassuring, right? Knowing there's that extra level of care being taken. What about for the nurses, the pharmacists, everyone working within this system?
That's what gets me excited. It's about giving them their time back. No more drowning in paperwork, constantly second guessing. They can focus on what they're good at, what they trained for, actually taking care of people.
That's what it's all about, right? Instead of battling the system, they're empowered by it.
Exactly. And, this could be just the beginning. The article focused on hospitals, but imagine this tech in other places. Nursing homes, hospices, even mobile clinics. Each one has unique challenges, but also huge opportunities.
That's a great point. It makes you think, one article, and we've uncovered so much. That's the beauty of a good deep dive, isn't it? Thanks for joining us on this exploration of how technology is changing the game for controlled drugs in healthcare. Until next time, keep those minds sharp, and we'll see you on the next deep dive.
Thank you for tuning in. Visit getclara.uk to learn more about how Clara, the leading electronic controlled drug register, can help your pharmacy stay compliant and efficient.